Assalamualaikum and good day to Dr. Nosem and to all my fellow groupmates. This is my orthodontic case presentations, and this presentation is divided to two parts. Part A is fixed appliance and part B is removable appliance. Okay, let's move on. I will start with the orthodontic examination and diagnosis. For the patient's detail, this patient is Miss A, and she is 21 years old Malay female with the complaints of malaligned upper and lower teeth, and it was difficult for her to clean the teeth, and these patients claim to be medically fit and healthy. For extraoral examinations, and these are the pictures of the patient in three views. It is anterior-posterior view, vertical view, and transverse view. For anterior-posterior view, I would say that this patient has class 1 skeletal pattern with straight facial profile. As in for vertical view, this patient seems to have lower mandibular plane angle. Actually, we can see the real FMPA of this patient because due to the limited picture, and this patient seems to have moderate lower anterior facial height, and transversely there is no significant asymmetry detected on the face, and the patient has competent lips. For intraoral examination, these are the intraoral pictures of the patient's dentitions, and these patients seems to have fair oral hygiene, normal oral mucosa. There is no active carious lesion present, and all her teeth seem to be sound, and mass supragingival calculus can be seen, and the teeth present is all teeth except for all 8. For occlusal analysis, this is the picture of the upper arch of patients. This patient seems to have U-shaped arch, and for the labial segment, I can observe that this patient has severe crowding around 10 mm, especially at the 11, 22, 23, and T3, and 11 is rotated distolabially, 22 rotated distopalatally, 23 and 33 seems to be displaced labially. And for the buccal segment at the left side, this patient seems to have mild irregularities, and for the right buccal segment, 1-4 is rotated distolabially with severe crowding of 10 mm due to the rotated 1-4. And for lower arch, this is the lower arch of the patient, and the arch is U-shaped. And for the labial segment, I would say that this patient had severe crowding around 14 mm at the area of 3-2 and 4-2, whereby the 3-2 is displaced lingually and 4-2 is also displaced lingually. For the buccal segment at the left side, at both left and the right side, there is a mild irregularities on the teeth. For the labial segment, this is the interarch analysis. In occlusion, this patient seems to have class 3 relationship. The tip of the lower incisors seem to be a bit anterior from the cingulum plateau of the upper incisor, and this patient had reduced overbite of 5% complete to tooth, and this patient seems to have overjet around 3 mm, which is in the normal range, and there is midline shift of 2 mm to the right on the upper teeth and 4 mm to the right on the lower teeth, and this patient seems to have crossbite on tooth 1-2 to 4-3 and 2-2 to T3. For the buccal segment, the canine classification on the right side, I would say that this patient has class 3 quarter unit, and for the left side, class 2 half unit. And this is the molar classifications. For the right side, I would say that this is class 2 half unit, and for the left side, I would say that this patient has class 2 quarter unit. And this is the OPG of Miss A, and I would conclude that this patient from the OPG, all teeth are present with impacted 1/8 to 8, 3/8, 4/8, and it seems to that this OPG there is no horizontal vertical bone loss detected and no presence of radiolucency or radiosity present at the crown of the tooth or roots of the tooth. And this is the lateral calf of the patients. After doing the analysis of lateral calf of the patients, and these are the results. For the SNA, the value is in the normal range, and it shows that this patient maxilla is normal in related to the cranial base, and for the SNB value, it is also in normal range, and it concludes that this patient also had normal mandible in related to the cranial base. For the A and B value, this patient had normal A and B value, it is in the normal value, so this patient has skeletal class 1, and if this patient had skeletal class 1 pattern, so this patient is not eligible for A and B corrections. And for SNMXP, it is also in the normal range. For MMPA value, this patient seems to have increased MMPA, and for the upper incisor and related to maxillary plane, these patients also had the value is also in the normal value, which shows that this patient's upper incisor is normal with normal inclinations, and for the lower incisor in related to mandibular plane, it is also in the normal value, which shows that the lower incisor is in the normal inclinations, and for the inter-incisor angle between the upper incisor and lower incisor, it seems to be a normal value too, and the LAFH percent, which is the lower anterior facial height, seems to be increased. Okay, moving on to pre-treatment IOTN, I would say that this patient has IOTN of 4D, which is the severe displacement of teeth greater than 4 mm. Okay, for summary, this patient is a 21 years old Malay female with the complaint of malaligned upper and lower teeth, and it was difficult for her to clean the teeth. She presented with class 3 malocclusion on class 1 skeletal pattern. There is severe crowding on upper labial segment and upper right buccal segment, and there is severe crowding on lower labial segment too. In occlusion, this patient has reduced overbite of 5%. There is crossbite involving tooth 1-2 to 4-3 and 2-2 to 3-3. And canine classification is class 3 quarter on the right side and class 2 half unit on the left side, and molar classification is class 2 half unit on the right side and class 2 quarter unit on the left side. So I would say that the etiology of these patients to have malocclusion is dental-alveolar discrepancy. For the problem is, first and foremost is the fare or hygiene. The second one is the severe crowding on upper labial segment, and the third one is the severe crowding on upper right buccal segment and also lower labial segment. And next is the reduced overbite of 5%, crossbite on 1-2 to 4-3, 2-2 to 3-3, upper midline shift to the right 2 mm and lower midline shift to the right 4 mm. 8. Canine relationship class 3 quarter unit on the right side and class 2 half unit on the left side, and molar relationship class 2 half unit on the right side and class 2 quarter unit on the left side. Okay, for the aims of the treatment of this patient, first we need to improve the oral hygiene of the patient. Second, we need to relieve the crowding on the upper labial segment. Third, we need to relieve the crowding on upper right buccal segment. Fourth, we need to relieve crowding on lower labial segment. And fifth, we need to increase the overbite of the patients. Sixth, we need to eliminate the crossbite of these patients. 7, we need to correct upper and lower midline shift. And 8, we need to correct canine classification to class 1 bilaterally. And 9, we need to correct molar classification to class 1 bilaterally too. For the treatment plan, we have preventive treatment plan and orthodontic treatment plan. For preventive treatment plan, I would suggest that these patients have OHE and OHI and scaling and prophylaxis first before moving on to the orthodontic treatment plan, which is upper and lower fixed appliances. Before proceeding to review. For part B, this is moving on to part B, removable appliance. Okay, this is the case that I got, and she is 14 years old Malay lady, complained of misalignment of her upper front teeth, and she presented with class 3 incisor relationship with reverse overjet of 2 mm on 1-1, overjet of 2 mm on 2-1, and reduced overbite of 5%. Okay, these are the pictures of the upper arch and also the lower arch. As we can see on the upper arch, this patient seems to have mild crowding on upper labial segment. We can see the reverse overjet of the 1-1 and a bit of overjet of 2-1 and mild crowding and mild spacing on the upper left buccal segment, mild irregularities on the upper right buccal segment. And for the lower arch, we can see that this patient has mild crowding on lower labial segment and mild crowding on the lower right buccal segment and left buccal segment. So this is the design of upper removable appliance that I propose. It consists of Z spring, labial bow, Adam clasp on 1/6 and 2/6. Forgot to mention Z spring on 1/1, labial bow from 1/3 to 2/3, Adam clasp on 1/6 to 2/6, and posterior backplane on the posterior teeth for the management of overbite and base plate. For the labial bow, it is used to reduce the overjet of 2 mm on the tooth 2-1, and for the Z spring, it is an active component to correct the reverse overjet of 2 mm on 1-1, and the incorporation of posterior backplane, which is to disengage the occlusion on the anterior teeth so that the anterior teeth can it will allow the eruptions to increase the overbite of this patient, which seem to be reduced. And then for the Adam clasp on 1/6 and 2/6, they act as retentive components for the removable appliance. And last but not least, base plate act as major connector to incorporate all the components into single function unit. And that's all for presentation, for my orthodontic presentations. Thank you for listening. I hope all of you are in good condition there. Good day. Bye.